Mr. President, I want to talk a little bit about health care this morning. I know that the majority leader has suggested in past weeks that all of these contacts and concerns that I get from Missourians are just made up, though he didn't, to be truthful, didn't target Missouri and say only Missourians were making these stories up. He just said everybody was making these stories up. That's clearly not true. And the law regarding health care, the law that is applied every day with great consistency, continues to be, Mr. President, the law of unintended consequences. The law that so often is impacted by what we think we're doing in the Congress, only to find out that the consequences of those actions were well beyond the discussion that the Congress was having. Certainly, if we had that debate again today, the debate that you and I saw in 2009 and early 2010, the Congress would be better prepared for that debate. The country would be better prepared for that debate. People would understand what's at stake in a better way. But what I see every day, again, are things that people didn't anticipate that would happen that would. Here's talk about a letter we got from Jack in Kansas City, Missouri. He said, "I'm a retired hospital chief executive officer and glad to be retired because of ObamaCare." That's his quote. "I'm a retired hospital CEO and glad to be retired because of Obamacare." He points out in an absolutely correct way that in most communities in Missouri, the hospital, particularly in our small and mid-sized communities, is a real source of pride, a place of healing, a major employer, and of course the potential end result of what's happening now with the changes we made and how hospitals are treated, particularly hospitals in rural areas, hospitals in underserved inner city areas. The programs that were in place are basically going away. And why did they go away? Because the president assumed, and the members of Congress, I'm sure, that voted for this piece of legislation assumed that everybody would be covered. Everybody would have insurance, so we didn't need to have special programs for people that dealt with people who didn't have insurance, hospitals that dealt with people who didn't have insurance. We didn't need special programs for underserved areas, and clearly that is not the case. If we look back at that debate, many people were saying this will not work out the way the well-intended proponents of this law think it will work out. We're going to continue to have people without insurance. In fact, the Congressional Budget Office reiterated again just recently that at the end of 10 years, how many people won't have insurance? 30 million. How many people didn't have insurance when we started? 40 million. To disrupt the entire healthcare tableau of the country, to add possibly 10 million, and I think we're going to have people who lose insurance at work who have had insurance at work. In fact, I think that'll be one of the major unintended consequences as we approach the end of this year, as we go into next year. I'm talking to too many employers in Missouri who just say there's a place for people to go now. They can go to the exchange. We've struggled with this for a long time. And even though we're not covered by the law, even though we don't have 50 employees, we're going to no longer provide the insurance at work that many of these employers have provided for decades. Others have provided all the time they're in business, even if it's less than decades. Norman from Warrensburg, Missouri, is concerned about what will happen with Medicare and Medicare Advantage. He says, "I was struck with Guillain-Barré in 2005, which left me disabled as well as with other resulting health issues. We expended more than around $3,000 out of pocket annually just for my prescriptions alone, and that was under a Medicare Advantage plan. This plus the Medicare premiums and the physician's care takes almost all of our Social Security benefits. We live in a small community." He describes Warrensburg as a small community of around 18,000, and would probably be one of those communities to lose the Medicare Advantage type of insurance. The gap that he thinks allows his family, and I would suspect that's right, to have the health care that they've had and would like to continue to have. Paula from O'Fallon, Missouri, says that she believes a lot of people are going to leave their job as spouses because spouses are going to look at who has the better insurance and try to benefit from that better insurance. According to her husband's company is paying a large fine because of their good insurance is better than Obamacare. I imagine more realistically what that letter might have said is that their insurance isn't exactly what the Department of Health and Human Services believe is the right kind of insurance. When the government makes these decisions, instead of people or people closest to them, their employers, one of the benefits of the employer-provided system was that people didn't have to worry about this. In fact, almost everybody looked at their insurance, they talked to their employer, they decided they'd get more information when they needed it, and when they needed it, usually the information they got was pretty good information for them to have. Now we've got people trying to figure out, if they have choices, a complexity of choices and alternatives that they've never had to deal with before. And frankly, Mr. President, they're not going to like that. And I think one of the other unintended consequences of this law is that people are going to begin to say, I know that a government-run program wouldn't be as good as the health care I used to have, but I just don't want to be responsible for it anymore. What we probably are doing here is building a groundswell of people who just no longer want to be forced into the decisions that they've never had to make because 85% of everybody had insurance at work. And 90% of them thought the insurance they had at work really met their needs. I think we'd be really lucky if very far into the Affordable Care Act, 90% of the people that have insurance think that the insurance they have moving forward meets their needs. Angela from Dexter, Missouri said her aunt and uncle are searching for a new doctor after their doctor moved out of state. They're having trouble finding a physician in the Dexter area that will take new Medicare patients. Another unintended consequence. We cut Medicare in this bill, those people who voted for it, the law itself that I wasn't for, but it's the law. One of the reasons I said I wasn't for it is we're cutting a program that we already know is challenged, Medicare, by $500 billion to form a new program. There was no city council, there was no county government, there was nowhere else in America that if they came to the meeting and said, okay, we've got a program that's in real trouble, so what we're going to do is cut that program to start a new program. And particularly a program like Medicare that people have been led to believe that they could rely on. Well, when you cut Medicare by $500 billion over 10 years, something happens. And what Angela's aunt and uncle are seeing is one of the things that happens. People try to find a doctor who will take Medicare only to find doctor after doctor who say, well, we're going to continue to serve the Medicare patients we have as long as they're around to serve, but we're not serving new Medicare patients. Joanna in Kansas City said her son goes to college where he's required to have health insurance. His health insurance increase that he gets through the school 40% this year. Wayne in Moberly says premiums and his prescription drug costs have increased, and he's concerned that that's because of all the new requirements that you have to meet. He said, the future does not look good from where I stand as a small business owner and a farmer. Donna in Napoleon, Missouri says that her insurance has gone from $93 twice a month to $156 twice a month. And then this was, I thought, the interesting thing, Mr. President, about her letter. She said her insurance would go up even more if she gets a chance to work more. There is a lot to be said for assisting people to get health insurance who can't otherwise afford to get health insurance. But one of the things that I never heard debated at any extensive way was, well, what happens when people are at the edge of moving to a new level of work, gets them a lower level of benefit? So that's what Donna's saying here. If she gets to work more hours, she'll have less assistance buying her health insurance, and her health insurance goes up. The government should not be in the business of looking for ways to encourage people not to work, just like the part-time work we see all over the country now. One of the great workplace impacts of the health care law was the government for the first time ever said, to most employers of more than 50 people, You have to provide health insurance to anybody that works 30 hours a week. And so what did employers for the first time ever hear the government saying? If you work less than 30 hours a week, you don't have to have that health insurance. And so employer after employers made the decision for new employees, we're going to hire 3 people at 27, 28 hours rather than 2 people at 40 hours. We're going to meet our workforce needs in a new way. Those individuals don't have coverage. Many individuals at that level of, frankly, hours of work that used to have coverage no longer have coverage. An awful lot of companies used to provide coverage at half time, at 20 hours. But when the government says you don't have to do it until 30 hours, turns out a lot of people don't work more than 30 hours because they don't have an opportunity. Or maybe they work almost 60 hours, but they work 60 hours at 2 different jobs, as did a lady that I mentioned just last week who contacted our office. David in Kansas City said he's retired from the railroad industry, and on April the 1st, his former company canceled plans for retirees 65 and older with the idea that, well, I don't know what the idea was. I do know that a lot of companies have done that. Not just the railroad industry. IBM announced that they would no longer provide health care coverage for their retirees. I assume the retirees that are 65 and older are on Medicare, but what kind of supplement do they have? They used to have a supplement that was part of a big IBM plan. Now they don't have that anymore. David had access to a retiree plan from the railroad industry. He doesn't have that anymore. UPS announced that the dependents and spouses that are in part of the UPS family wouldn't have insurance anymore. The unintended consequences keep on coming, and we need to continue to look at what we can do to see that people have access to great health care. We're talking now, as we should be, about veterans' health care and how veterans can have access to great health care. And there's a moment, Mr. President, right now when we can look at this issue. The veteran service organizations are looking at this issue in a new way. Alternatives are a good thing. You know, the veterans should have the best health care in the best location for them at what is the best way that taxpayers can provide it. The VA, frankly, the Veterans Administration should be the best at some things. They should be better than anybody else at dealing with IED kinds of accidents, with eye accidents, with the loss of limbs and other things that have happened that happen to veterans in unfortunate numbers because of the kind of conflicts we've been involved in. Nobody should be better at that than the VA. The VA may be the absolute best place to go for that kind of injury. Post-traumatic stress. You know, our veterans have problems because of the conflicts they've been in, but they have problems because, you know, the National Institute of Health says 1 out of 4 adult Americans has a diagnosable mental health problem. And as I've asked the Surgeon General of the Army and the other forces about this, do you think that's reflected in the military? In a hearing a couple of months ago, the answer was yes. She said, we recruit from the general population. We don't have any reason to believe that our population serving in the military doesn't reflect that same thing in mental health issues. And some of those mental health issues, like post-traumatic stress, the VA should be better than anybody else at. But a lot of the mental health issues, the VA, there's no reason they should be better than the facilities. You may have to drive to another state to drive by as you drive to another state to get to a veterans facility, or have to drive 120 miles or 150 miles in a veterans VA van transportation. If that's what you want to do as a veteran, I think we ought to be sure that veterans continue to do that. But if veterans want to get better care, closer to home, more choices, we should do that and let the Veterans Administration compete to be the best at what they can be at. what they can be the best at. There's no particular reason to believe that the Veterans Administration is going to be the best of everybody in the country at normal internal medicine. There's no reason to believe that the Veterans Administration is going to be the best at dealing with cancer or heart issues or other issues. But if there's a veterans hospital that somehow figures out how to do that, that's fine. But don't make veterans drive 120 miles by a dozen facilities that could do just as well or better because we've decided we want to put people in a system that is totally defined by the government. One of the things we're learning here, I think, is that people can make choices in so many areas better than the government can make those choices for them. And so as we think about our veterans, as we think about what we can do to be sure that they get the best care, that they're honored, their service is honored in the way they were led to believe it would be honored, this is a great time to have this discussion. So whether it's health care for everybody else or health care for veterans, the Congress of the United States and the country have probably never been in a better position to talk about these issues. We see the unintended consequences of taking steps in the wrong direction. Now, Mr. President, it's a great time for our veterans and health care generally to see what we can do to take steps in the right direction.